in this procedure, I will be performing the anatomy and physiology for respiratory system assessment. So without further ado, let's get started. Good evening, ma'am. So the first step in this procedure is to explain the procedure to the client, to establish rapport to the client. So, hello ma'am, good evening. So in this procedure, ma'am, I'll be performing respiratory system assessment. So we're in comprehensive respiratory assessment can detect respiratory problems before they become emergencies. And also a respiratory assessment provides information about the patient's, about your status and clues about next treatment steps. And after that, prepare all the equipment needed in this procedure and wash hands. So can you give me your wristband, ma'am? And can you please state your name, age, and date of birth?
LCC Tapuco, 48 years old, December 2, 1973.
Okay. And then after that, I will wear my examination gloves. So in this procedure, there is a sequence to follow. The IPPA, which means that I for inspection, P for palpation, another P for percussion, and A for auscultation. So ma'am, can you sit down here for the procedure of inspection or the sequence for inspection? I'll just assist you to sit down. So for inspection, let's inspect for the symmetry of the back and scapulae. Okay, inspect for spine for mobility, structural deformity, symmetry, and posture. And also, let's inspect for patient skin color, presence of lesions, and hair distributions. Okay, so in inspection, we use our sense of sight. So in the second sequence, the P for palpation, so we use our sense of touch. And also for palpation, I will just gently palpate the posterior chest, ribs, and spine. Note for tenderness and any deformities. So I'll start now palpating. We start at the level of C7. Okay, and then down to T12, where the apices of lung located, and especially when the lungs filled with air, and then when we inhale, our lungs expanded, where the T12 located. Okay, so also in palpation, there are two divisions that we need to follow before proceeding to percussion. So the two is the assessing for symmetric chest expansion, and then the second one is assessing for tactile primitives. So I'll proceed now, or I'll begin with the assessing for symmetric chest expansion. So I'll begin now with the assessing for symmetric chest expansion. So just place one hand on the posterolateral wall, chest wall rather, on the with the thumbs at the level of T9 and T10. Okay, and then slide hands medially like that to pinch up a small fold of skin between the thumbs, and ask the patient to take a deep breath. So ma'am, we're going to start now, and can you take a deep breath before I'll immediately pinch up a small fold of skin between your between thumbs. Okay, can you okay, another one, ma'am. Okay, and then note any log in expansion. So normally the thumbs move away with each other from 5 to 10 centimeters. So in the second step for palpation is assessing for tactile firmitude. So I will use either the palmar base of my fingers or ulnar edge of my hands. So, and then touch the patient's chest while she repeats the phrase 99 or blue moon. Okay. So start over long episays and palpate from one side to another. So ma'am, I will place my ulnar edge of my hand here. Can you say or repeat 99 or blue moon? Okay.
Blue moon. 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 Blue moon.
Okay. So we're done for assessing for tactile firmitudes. Let's proceed to the third sequence of the respiratory system assessment, which is the percussion. So in percussion, there are also two divisions that we need to follow. The first one is assessing for the lung fills, and the another one is assessing for diaphragmatic excursion. So before we proceed to percussion, I just need to tell my patient the different tones or sounds in percussion. So ma'am, in the different sounds or tone in percussion is the flat. Flat sounds is soft intensity, high pitch, and short duration, and it's over in the bones. And also there, let's note for any large pleural effusion, and then that's for the flat sounds. So the second one is the dull sounds, and it is medium intensity, medium pitch, and duration. And it's over in the liver. We heard it in the liver, over the liver, and our lungs. And also, there's a if we heard the dull sounds, we there is a presence of pneumonia, tumor, or pleural effusion. And there's the third one, which is the resonance. So resonant is the normal sounds for our normal lungs. So it's loud intensity, soft intensity, low pitch rather, and long duration. So the fourth one is the hyper resonance, which is very loud, low pitch, and longer duration than the resonance. So again, our resonance is normal lung and normal sounds. Okay. So I'll begin percussing. Begin with the assessing for lung fields. Okay. So I will start at the apices and percuss the band of normally resonant tissue across the top of both shoulders, and then percuss in the interspaces. Make a side-to-side comparison all the way to the lung region, and then percuss at the 5 centimeter intervals. Okay, I'll begin now percussing. So I will use my fleximeter, and then I will use my flexor. Okay. So normally when we percuss, we heard resonant sound. Okay. So also in assessing for lung fields, it's better to remove the patient's gum. Okay. So next is assessing for diaphragmatic excursion. So let's proceed now to assessing for the diaphragmatic excursion, which is a positively correlated with lung inspiratory volumes and can accurately reflect the muscle strength and function. So here I will begin with the left lung. So I will palpate, I will percuss rather, the first in the left lung of the patient, and then I will ask my patient to exhale and hold it briefly while I percuss down to the scapular line, and until the sound changes from resonant to dull sounds. Okay. So can you exhale, ma'am? Exhale. Okay. Exhale, and hold it briefly. Okay. Uppercut muna. So in resonant sound, it's normal until we so until we heard the dull sound that changes from resonant to dull sound. And then we use our marker for the first mark spot. Okay, for the first mark spot of the patient. So and then so while percussing in the scapular line of the patient in the left lung, we heard first the resonant sound before it changes to dull sounds when we hear in the diaphragm. So in the first mark spot, I'll begin here percussing. So it will change to resonant sounds here in diaphragm or in first mark spot. Okay. Okay. So I'll begin percussing at the first mark spot in the patient. And then okay. And here is the second mark spot. Okay. And then I will use my ruler to measure. Okay. So in this procedure, the sound changes. Well, the sound changes to resonant to dull sound because the lungs already expanded. Okay, so while measuring the first mark to the second mark, it normally the normal the normal measures to diaphragmatic excursion is to 3 to 6 centimeter. So when I measure it, it's 5 centimeters, so it's normal, about normal. Okay. So we're done now at the 3 sequence, which is the inspection, palpation, and percussion. So let's proceed to the last sequence, which is the A for auscultation. So ma'am, can you just please sit down, ma'am? Sit down. Okay, so there are 2 divisions also in auscultation, which is assessing for breathing sounds and assessing for voice sounds. So let's begin first in the assessing for breathe sounds using the stethoscope. Okay, so evaluate the presence and quality of normal breathe sounds of the patient, and then the patient is sitting, of course, and leaning forward slightly with arms resting comfortably in the laps. Okay. Okay. So also, next step is instruct the patient to breathe through the mouth a little bit deeper, and then I will ask my patient if she felt dizziness, headaches, or pain. So, ma'am, Do you feel any headache or dizziness?
No.
Okay, that's good to hear. And then I need to be careful to monitor the breathing throughout the examination and offer times for the person to rest and breathe normally. Okay, so with the use of flat diaphragm of the stethoscope, I'll just hold it firmly on the patient's chest wall. So again, if the patient feels dizziness or headaches, we need to stop the procedure and make the patient comfortable and resume after the patient's fine. Okay. So I will listen to at least one full respiration in each location and make side-to-side comparison. Okay. Can you breathe, ma'am? Breathe, exhale, inhale while I auscultate, okay? Okay, wait. So while standing behind the patient, listen to the following areas: posterior from the apices at the level of C7 to the bases of around T10 rather. And then laterally from the axilla down to the 7 to 8th rib. So 1 to 7 rib is considered true false, and then 8 to 12 considered as false ribs. Okay. So can you exhale, inhale, ma'am, while I auscultate? Okay. I'll begin, ma'am, huh? So you just okay. Inhale, exhale. Inhale, exhale. Inhale, exhale. Inhale, exhale. Okay. Okay. So after that, after assessing for breathe sound for the patient, let's proceed to the second division for auscultation, which is assessing for voice sounds. Okay. So first step is to determine the quality of voice sounds or vocal resonance, and ask the patient to repeat the phrase while I listen to her chest wall. So, okay, ma'am, there are three sounds in auscultation, which is the bronchophony, whispered pictoriality, and then agophony. So, in bronchophony, ma'am, there is you will repeat the 99 phrase, okay? For whispered pictoriality, you repeat either 1, 2, 3 or ABC. And then for agophony, ma'am, you will repeat the phrase or phonate the E sounds, long E sounds. Okay, ma'am? Okay. So I'll begin na, ma'am, sa bronchophony, which is you will repeat the 99 while I'll auscultate you. Okay. When I place my diaphragm here, you will say or you will repeat 99. Okay, until I will end in the bronchophony. Okay, ma'am.
99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
Okay. So we're done with the bronchophony. Let's proceed to the second one, which is the whispered pictoriality. So we'll just repeat 1, 2, 3 or ABC. So mapili ka lang, ma'am, sa ilang duwa kung ano i-repeat mo. Either ABC or 1, 2, 3. Is that okay, ma'am?
Mm.
How are you so far, ma'am?
Okay.
Ma'am?
Fine.
Okay. So I'll begin now, ma'am. So you'll just um, choose either 1, 2, 3 or ABC and whisper pictorially, okay?
ABC. 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 ABC.
Okay, so we're done with the bronchophony and whispered pictorially. So we'll end at the auscultation when I already done with the egophony. So, mom, in egophony, can you phonate the long E sounds like E?
E.
Okay. So, I'll start na, ma'am. I'll begin.
E. 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 E.
Okay, thank you. So we're done now at the respiratory assessment. In the procedure, we're done with the sequence of IPPA. For inspection, we're done. Palpation, we're done. Percussion, we're done. And also, we're done with the auscultation. So we'll proceed now to the another sequence for IPPA in the anterior chest of the patient. So we're done again in the posterior lateral chest. So I proceed now to the anterior chest of the patient. So the sequence again for the anterior chest is the same for the posterior or lateral chest. So inspection, palpation, percussion, and auscultation. So I'll begin now in the first sequence, which is the I for inspection. So inspect for the symmetry of thorax, ribs, and clavicles. Also, inspect for skin color of the patient, presence of lesions, and note of width of costal angle. So the normal width of costal angle is 90 degrees or less. So when 90 degrees more than it is more than 90 degrees, we expect the presence of barrel chest. So barrel chest is like and then it's between the scapula and the center of the anterior chest if the patient is having barrel chest. Okay, and note for manner of breathing, and then level of consciousness of the patient, and then observe for any signs of respiratory difficulty and assess for respiratory rate, depth, and symmetry. Okay. So, how are you doing today, ma'am? Are you fine?
Yes.
Still fine, okay. Very good. So, we're done with the inspection. Let's proceed to the second sequence in this anterior chest, which is the palpation. So, there are two divisions that we need to follow again. So, assessing for symmetric chest expansion and assessing for tactile firmitus. So, let's proceed, or let I begin with the assessing for symmetric chest expansion. Okay, so I'll just place my warm hand on the anterolateral wall with thumbs along the costal margins pointing towards the sphenoid process. Okay, so can you take a deep breath, mom? While I'll immediately okay, mom, wait. Okay, can you take a deep breath, mom? Okay, again. Okay, thank you. So watch again if the two thumbs are moved with each other. And then normally when the thumbs move with each other from 5 to 10 centimeters, it's normal. Okay. So the next one is I will assess for assessing for tactile firmitude. So in assessing for tactile firmitude, I'll begin palpating over the long apices of the patient at this supraclavicular areas, and then compare vibrations from one to side to other as the patient repeats the 99. Okay, so also take note that avoid palpating the female breast tissues. Okay, so can you repeat 99, ma'am? Okay.
99. 99. 99. 99. 99. 99. 99. 99.
Okay. So we're done with the palpation and assessing for symmetric chest expansion and assessing for tactile firmitude. So I'll proceed now to the third sequence, which is the percussion. Okay. So I'll begin percuss at the apices and down to the lung region, and then percuss the interspaces and compare one to side to another once I move down to the anterior chest. And then okay, I'll begin now. Okay, so also note for the borders for cardiac and liver dullness, because when the lungs is normal, we heard resonant sounds while percussing. Okay, so we're done now at the percussion. Let's proceed to the last sequence, which is the auscultation. So down to auscultation. So I'll assessing again for the two divisions in auscultation, which is assessing for breath sounds and assessing for voice sounds. So I'll begin with the assessing for breath sounds. So I will use my stethoscope to auscultate. Okay. So I will auscultate the lung fields over the anterior chest from the apices, okay, from the apices down to supraclavicular, okay, supraclavicular areas down to the sixth rib of the patient. Okay, so can you exhale and inhale, ma'am, while I'll auscultate?
Yes.
Okay. Okay. Okay, thank you so much, ma'am. So, progress from the side to side as I moved downward earlier. And I listened to the full of respiration on each location. And also, I need to evaluate the normal breath sounds, noting for any abnormalities and adventitious sounds. So I'll proceed now in assessing for voice sounds of the patient. So I will determine the quality of voice sounds or vocal resonance, and then I will ask again my patient to repeat phrase while I listen to the chest wall of the patient. Okay. So, ma'am, in auscultation, I said earlier that there are three types of sounds, which is the bronchophony, whispered pictorially, and then the algophony. So, I'll begin with the bronchophony, which is you will repeat the 99 while I'll auscultate again. Okay, ma'am? Is that okay?
Yes.
Okay, thank you.
99. 99. 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
Okay, thank you. So after the bronchophony, I'll proceed now to the second types of the sound, which is the whispered pictorialogy. Okay, so you will repeat, ma'am, 1, 2, 3, or ABC between that two, or either that two. Okay, while I'll auscultate. 1, 2, 3, or ABC. Is that okay, ma'am?
Yes.
Okay, thank you.
1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3.
Okay, so we're done with the bronchophony and then the whispered pictorialogy, and then I'll proceed now to the last type of sound, which is the egophony. So can you uh, phonate the long E sounds, ma'am? Like E. Okay. Okay. So I'll begin, ma'am, how I auscultate when you said E sounds, the long E sounds.
E, 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 E.
Okay, thank you so much, ma'am. And then we're done with the sequence in the posterior and lateral chest. The sequence for IPPA, inspection, palpation, percussion, and then auscultation. And also we're down to in the anterior chest of the patient with the same sequence: IPPA, inspection, palpation, percussion, and auscultation. For the procedure in respiratory system assessment, of course, after that, I will escort my patient to either lay down or sit, depends where the patient's comfortable. And then also after that, I will do the aftercare of the equipments, and then equipments I used rather, and then I will throw any trash or garbage properly, and then after which I will do the documentation and the patient's results while doing the procedure, while interviewing for any abnormalities, structural deformity, and also for the breathing sounds of the patient and voice sounds for inspection, palpation, percussion, and auscultation for any presence of respiratory condition. And also, lastly, I will remove this examination glove, and I will throw it properly. Okay. And then lastly, I will do the washing of hands. I will do washing of hands to before and after the procedure, and before and after touching a patient, to prevent transmission of microorganisms. And that's all. Thank you for watching.